These are the 4 diseases which will present with whitish discoloration of the skin and very important for exams. So that's the reason why I'm discussing. Watch this till the end to know all the important details related to these 4 diseases. Hello dear students, myself Dr. Maddineni Srinivas, Dermatology faculty from Bharat. Welcome to Crack Derma DrMSD. So first disease which we are going to discuss is called as the albinism. Remember dear students, in this the melanocytes are normal, but the function, the enzyme which is going to produce the melanin pigment is problematic, which is tyrosinase. It is a rate limiting step. Because of the problem abnormality in this enzyme, there will not be any melanin production. So that is the reason why, though there are normal melanocytes present in the skin, but they will not produce any pigmentation. So that is the reason why the skin and also hairs and eyes, all of them are going to be white in color in the patients of albinism. You have heard of cutaneous albinism and oculocutaneous albinism. This is the reason for this. Okay, the next disease which you need to know about is piebaldism. I am sure that you have heard about this condition. If so, hit that like button. And in this, the buzzword you need to remember is called as the white forelock. That is a bunch of the hair present over the forehead is called as forelock, and this is going to be depigmented or white in color. What is the reason for this? Remember dear students, in this piebaldism there is going to be a problem in the neural crest, because of which the melanocytes which should actually reach the stratum basal layer, which is the address for the melanocytes, they will not reach the stratum basal layer of the epidermis. That is why the skin is going to appear white in color in few areas of the body, and most important one to remember in piebaldism is the forelock area. So it's called as white forelock. So the melanocytes are going to be absent in the skin if you do a biopsy. Okay, this is the important point. And next condition is nevus depigmentosus, and whenever you read this, try to discuss along with nevus anemicus, because both have few similarities and few differences. So what are the similarities? So both of them will be localized, and both of them are going to present as congenital white patches. But remember, nevus anemicus is not a melanin disorder. The basic problem in the nevus anemicus is, as you have heard the name, anemia, something related to blood vessels. So blood, okay. Here the basic problem is that there's going to be a excessive vasoconstriction, because of which the skin is going to appear pale in color. So to describe pale, what is the term we use? Anemia. That's why it is given the term anemicus, nevus anemicus. And remember, everything related to melanocytes is going to be absolutely normal in nevus anemicus. Only problem is excessive vasoconstriction. As you can see here, it is written excessive vasoconstriction. In nevus depigmentosus, there is going to be basic problem in giving the melanin pigment to the surrounding keratinocytes. I hope you remember this concept of epidermal melanin unit, which is one melanocyte is going to supply the melanosomes and also melanin pigment to adjacent 36 keratinocytes, and there is going to be a defect in that concept in nevus depigmentosus, because of which there is going to be reduced melanin transfer to the adjacent keratinocytes, and that is the reason why skin is going to appear white in color. So there is going to be reduced melanin transfer into the keratinocytes. Again, reiterating the same point, very important. So in these two diseases, the endoscopy, which is pressing the skin lesion with a glass slide, is going to be very, very helpful. In endoscopy, we are going to see that the nevus anemicus, the whitish patch, is going to increase in the size, as you can see here in this picture. So this is a patient of nevus anemicus. So if you consider this as a white lesion which was present before pressing the glass slide, after pressing the glass slide, what are you able to observe? That the lesion size is increasing. The reason for this is very simple. The lesional skin was white in color, the perilesional skin is normal in color, but when we press the lesion, what will happen? There's going to be reduced or vasoconstriction happening surrounding the lesion, because of which the surrounding skin is also going to appear white in color or pale in color. That is the reason why it appears to us that it is increasing in size, nevus anemicus lesion. Coming to nevus depigmentosus, here there will not be any increase in the size. So as you can see here, this is the child having nevus depigmentosus. So this is the lesion which is present, and even if you press with the glass slide, the lesion will be same. There will not be any change in the size. So this is how you can differentiate between depigmentosus and anemicus. And here you are able to see this is a patient of piebaldism having this white forelock. And remember, there is one syndrome associated with piebaldism. It is called as Waardenburg syndrome, in which there is going to be additional features of heterochromia iridis and also dystopia xanthorum and of course piebaldism. And also there can be sensorineural hearing loss also. So these are the 4 conditions about which you need to know in detail, and I hope this video was helpful. If so, please do that like button. Also do subscribe for more such awesome videos on a regular basis. Thank you so much. Dr. Maddineni Srinivas signing off. Bye bye.